Good afternoon once again, and thank you so much for joining us here at the Lions Club Health Fair. We have the start of our third presentation that will begin shortly. So for those inside the hall, we request that you keep the noise limit to a minimum. We have Dr. Chestnut, who will be delivering her presentation on diabetes, which will be starting shortly. And then after, we have the grand finale with a wonderful dance presentation, two dances from Bailamos, who will be performing on the outside stage. So I encourage you to stick around and enjoy both presentations. We'll be starting shortly on our live stream. So once again, I request for those inside the hall, keep the noise limit to a minimum if you can. Thank you very much. We'll be starting soon.
Life has changed and how important of a discovery insulin is. The blue circle represents diabetes, and it stands for the search for a cure. So we are always looking for a cure for diabetes. The World Diabetes Day Monument Challenge is something that we all try to do. It's just a way for us to represent diabetes, and so we light things blue. Here in Cayman, we actually light the clock tower and the water fountain here is square. In Cayman, they light the museum up, so everyone has a little bit of a different way of celebrating this. So with regards to type 2 diabetes in children, it's been around since the early 1990s, and before this we hadn't really seen it. but we have seen a dramatic increase in the incidence of this in children and adolescents. And a lot of this is linked to childhood obesity, and this is what I really wanted to talk about today. I wanted to talk a little bit about childhood obesity and what this means and what impact it is on our children. So it's very easy to calculate this. All you need is a scale and a ruler, and you can figure out height and weight, and you can find out body mass index. And what you have to do is, if you can see this lovely little graph to the right, it's multicolored, you graph the children on this, and you can see if they're in the green area, they are in the normal range. If they're in the yellow, they are considered overweight, and if they're in the red, they're the obese. So if we just look at the next slide, this is a very quick overview of all the complications of childhood obesity. And you can see this doesn't affect just diabetes. This affects neurological issues, cardiovascular, pulmonary. There's so many parts of your body affects. And a lot of people sometimes don't even realize that obesity increases your risk of cancers. You know, it increases your risk of colon cancer, and it increases your risk of uterine cancer as well. So there's so many parts of your body that this affects, and this is something that we all have to take quite seriously. When you think about cardiovascular complications in these young children that have problems with their weight, their hypertension risk is 3 times higher, and they also all will have cholesterol issues. They'll have very high bad cholesterol, very low good cholesterol, very high triglycerides. So it's very much a concern. And if people think that cardiovascular issues and diabetes aren't much of an issue here, you have to look at the English Caribbean. So if you look at the graph, you can see our mortality rates in the English Caribbean in particular. You know, this is a study that was done by the Pan American Health Organization quite a few years ago. And they looked at communicable diseases, cancers, external causes. And if you look in particular at the English Caribbean, which is the one to the very left, you can see by far and away that the cardiovascular and the diabetes are what we die from. So it is something we have to take very seriously here in the Caribbean. You can get gastrointestinal problems from the obesity, and gallstones and fatty liver. And a fatty liver is just where these kids have very high cholesterol. It then deposits in the liver. And when it deposits in the liver, it can cause fibrosis and changes to the liver. It can become cirrhotic, and these kids can get liver failure quite early on in their life. So it's quite serious that we consider this. You also think about pulmonary issues, and when you look at kids who are obese, about 1 in 10 of them will have sleep apnea. So that is quite significant. And you know, I think a lot of us are familiar with sleep apnea machines and people who have sleep apnea. So when you look at these children, you have to think that 1 out of every 10 of these kids are going to need a CPAP machine or have struggle with breathing at night. When you look at the orthopedic part of issues with the kids, they have more fractures, they have more musculoskeletal pain. They also get this thing called, they can get their femoral bone to slip, and so that can also be quite an issue. They tend to have more psychosocial problems. They have poor self-esteem, they get depressed, they have anxiety. They're quite often discriminated against school as well. And when they look at kids who are non-obese, when compared to non-obese kids, they do find that the obese kids tend not to complete college, and they're more likely to live in poverty. So this is something that affects them from very much a psychosocial aspect as well. Endocrine complications. So when you have obesity, especially in young girls, you can get extra male hormones. And I'm going to talk about that in one of the slides. You can get abnormalities in growth and puberty. So again, the excess weight causes a lot of these young girls to go into puberty earlier, much, much earlier than we would like them to. And it's one of these things that we, again, have to bear in mind. You know, if they start puberty earlier, they tend to be shorter and don't tend to grow quite as well. They often will develop sugar issues and diabetes, and I am going to talk a little bit about diabetes as well. So when you look at hyperandrogenism in females, which just means excess male hormones in women, you typically associate with this with polycystic ovarian syndrome, which again is very common. About 10% of women have this. And what you get is this excessive male pattern hair growth. You get hair growth in the side of the face, the chin, sometimes on the chest. You get irregular periods, and you also get this acanthosis nigricans, and I put a picture on it. It's where they get just the darkening of the skin on the neck, and often people think they're trying to rub it off, and what that is, it's a sign of high insulin in the body, and these young kids need to it's a sign of insulin and early diabetes and also acne. With these kids, though, they do tend to get a high sugar as well. And this is quite important because this high sugar happens in 16% of overweight kids. And when you look at the severely obese ones, that's up to 22%. So these young children are already having impairment in their diabetes from the time they are very young, and that's very significant. The CDC actually says that probably 1 in 3 children born after the year 2000 will have diabetes, which is terrifying. You know, when you think about the impact diabetes has right now in our system, and to think that we're going to all of a sudden have 1 in 3 children after the year 2000 be affected with diabetes, it's you know, staggering. Oops. I went too far there. So one of my questions I always throw to people is, which would you rather have, type 1 or type 2 diabetes? Because everybody thinks, oh, type 1 is the one that you have to give insulin and type 2 isn't as bad. Well, in children, you have to think about this. It's a little different. In type 2 diabetes in kids, their mortality is actually much worse than type 1. The type 1s actually live for a lot longer than the type 2s, and you have to be very, very aggressive with treating these young children that have type 2 diabetes. And another question I always ask is which would you rather have, adult onset type 2 or youth onset type 2? Because there is a dramatic difference between these two. So when you look at these young kids, if you look at the young kids between the ages of 15 and 29, and you can see on the graph on the slide, these young kids have a much higher risk of dying younger. They tend to do very, very poorly when they're diagnosed with diabetes when they're young, and we have to aggressively treat them. So when you look for life expectancy and you look at any obese adolescent, their risk of dying by middle age is 2 to 3 times higher than someone else their age who is not obese. And that, again, is quite significant. You know, 2 to 3 times higher is quite a change. It can shorten the life expectancy of these young children by anywhere from 2 to 5 years, and that's an effect equal to all cancers combined. So again, we have to take this seriously, the fact that it can affect the life expectancy so much. So when we look at diabetes, you know, when you look at obese children, 4% of them have diabetes. And like I said, early diagnosis is critical. You know, screening, you know, going to the doctor, getting these done. It's so important that you come out and do this. And we have to have very aggressive treatment, because aggressive treatment can slow it down. These kids typically have a very rapid progression, and even when they present at diagnosis, 13% of them are already spilling protein in their urine, which means they have kidney damage. 80% of them have cholesterol issues, and 14% have high blood pressure. So when we talk about childhood obesity in Cayman, you know, it's an important public health problem. You know, we need to identify the kids that are overweight and obese, and we have to be very active with screening them and seeing if any of them have these underlying conditions we're worried about. And what's so important too from a public health perspective is prevention. So when we look at data on childhood obesity in preschool children, you can see in the USA about 27% of the kids there, and preschool kids now, are overweight or obese. And we look at Cayman, so we look at, this is data from 2010 and 2011. And when we look at these kids, a total of 40% of them were overweight or obese, and 30% in 2011 were overweight or obese. So this is quite significant that we have so many of these children in preschool. So now these are 4-year-olds. You have to remember that. These are kids that are screened on entry into school. And again, my next graph just kind of shows you this over a few years from 2006 to 2011, and it shows the kids that are overweight, obese. And you can see this ranges anywhere from 25 to 30%, again, in our school entry children. So these are my 3 to 6-year-olds that you see. And when you go into high school, so these are ages 10 to 14, you can see this ranges anywhere from 30 to 35%. So this is a significant problem here. This is something we need to do something about. So if we use the Cayman data and we look at our 11-year-olds and we say 500 of them were screened, which is about what they tend to screen every year, 17% of them are obese, and this is from the data that we have. We know that there are 85 obese kids in that 11-year-old group. And so that means 3 of these kids are going to have asymptomatic diabetes that we don't know about. And if you look at the high school, again, ages from 11 to 16, you probably have about 20 children in the high school that have diabetes and we don't know about, and they're asymptomatic, so they do not have symptoms, which is why screening like this today is so important, that you do have these kids come out and you do screen them, because we need to find this, because these kids typically do very poorly unless they're treated aggressively and treated very early. So how did we get here? You know, it's many reasons. You know, a lot of this is environmental. You know, sugar-sweetened beverages, television, sleep are so important. People can drink a lot of calories very quickly. So when you look at this, you know, an average drink is about, you know, 250, 300 calories. And that's about 10 to 15% of our calories. And if kids are drinking a lot of juices and sodas throughout the day, you do tend to, you know, pack on calories quite easily. So it's important we watch that. You know, television too is one of these things, and I date myself by saying television. I should say screen, because when I say, oh, how much TV do you watch? Like, I don't watch any TV. And I said, well, what do you do when you go home? Oh, I'm on my tablet. So I realize now that I need to say screen time and not television, because nobody says TV anymore. So, you know, the amount of time spent watching TV, or even having just a TV or a screen in the child's bedroom, increases their risk of obesity. So I often tell parents, you know, you need to just watch this and decrease their screen time. So how much TV do we watch in Cayman? So this is important. They looked at 34 countries in 2010. They found that here in Cayman, 64% of girls watch more than 3 hours a day, and 53% of boys. And children who were sufficiently active here in Cayman, it was only 18% of girls and 33% of boys. And if you look at this next graph, you can kind of see, I actually put a red line where we are on it, and it shows the kids, and it shows the boys and the girls. So the boys are in the top graph and the girls are on the lower graph. In Cayman, the only country in this study that actually watched more TV than us and the boys were St. Lucia. You know, for the girls, nobody beat us watching TV. We watch more TV than any other country in this study, which again is a little scary. When we look at sleep, children are sleeping less. And this shortened sleep time actually relates a lot to obesity as well. So if you look at preschool children, and if you put them to bed at 8 o'clock or earlier, only 10% of them are obese when they're in their adolescent period. If you put them to bed at 9 p.m., 25% of them are obese. So simple thing to do, put your child to bed. You know, let them sleep. They have to sleep. And if they sleep, they tend to do better. So what can we do about it? We need to educate. We need to educate everyone. Medical personnel, parents, children's teachers. You know, it's not a one-sided thing. This is a community effort, you know, and it's lovely to see the Lions Club able to do something like this, because this is a community effort. It's not one person's job to do this. It's not just mommy and daddy. It's not just the schools. It's not just the doctors. It's everyone. So, you know, do we like talking about this? No. Do I enjoy talking about, you know, obesity in kids? No, it's horrible. It's a challenging topic to talk about with parents. But what we have to do is help medical personnel become more comfortable with it, to say, how do you open these discussions up? You know, I must say the pediatricians here on Island are fantastic with this now. They are very sensitized to it. So if you ever have a question about your child's health, go to your pediatrician. They are all fantastic, and they can discuss these things with you. Something simple, again, is plot that body mass index, you know, the height and weight, and just put it on a graph just to see where they are, because if we're seeing some concerns, then we can put in some prevention that would stop this from happening. The next thing is to educate parents. You know, breastfeeding, again, if you breastfeed the child for 3 to 5 months, they're 35% likely to be obese when they enter school. These simple things we can do all the time. Introduction to foods is always a fun one for parents. You know, children can refuse new foods up to 12 times, and so you just have to be persistent with encouraging new food. It can be a bit of a challenge. You'll eventually get there. Screen time, this is a big thing, and this is what I talk to a lot of the kids about, is they do have to limit screen times. And it's not that I'm saying you can never have a screen, but you want to say, okay, you're allowed 30 minutes or 45 minutes, then you need to take a break. What worries me is when these kids are on the screens for 4 or 5 hours at a time and never taking a break, never getting up, and then they tend to go and make poor choices when they go and, you know, choose a snack. They want to choose something really quick. If all you do is start to decrease screen time, these kids will lose weight and they will be healthier. Sleep. Now, this is just a really quick graph to talk about amount of sleep. So when you look at the infants and toddlers, these are how much hours. So, you know, an infant should get 12 to 16 hours. Preschoolers, anywhere from age 3 to 5, should get 10 to 13 hours. Grade schoolers, from 6 to 12, 9 to 12 hours. And teenagers should get 8 to 10 hours. So we really have to encourage kids to just get the amount of sleep. But it's hard because everyone has screens, everyone's watching this and doing that, and FaceTiming so-and-so. I Facebook this, I must admit, it all gets a little overwhelming sometimes for the kids because they just have so much interaction to keep them awake. Again, healthy behaviors is really focusing on educating children so they will eat healthier. Activity is very important too, so you want to encourage PE in the schools. It'd be lovely to have PE every day in school because it actually helps the kids to concentrate better, it helps their cognition more. So all these little things that we can start to do just in our environment are things that we can do to help decrease diabetes. Eat healthier, be active. When we look at education at children and teachers, they do find that if we focus on the younger kids, so 6 to 12-year-olds, they're more receptive, as I'm sure anyone with teenagers out there knows. They're the best ones that you can get strategies implemented in these kids that they can start to perform, make healthier choices and to do more activity. So you want to try and focus on these times, this really critical primary school time. And so this is just, just a little graph showing just type 2 diabetes in children. I've talked about a lot. I've talked about activity. I've talked about, sitting down at a meal with your family and making good choices, having a screen-free meal time is very important, helping them choose, which one should I choose. And of course, they're going to choose the wrong things sometimes, but that's what we do, that's just, but we have to make sure that they're choosing the right most often. So thank you so much. And I just put another little picture, some pictures up here too of, families going out and activity, a little baby sleeping, which is quite nice, and a book called about healthy eating for kids. So that is really what I wanted to talk about. So it was just the type 2 diabetes in kids. So thank you very much. I'm done.
Thank you very much, Dr. Chestnut. Let's give her one more round of applause for that very informative and very interesting presentation. I'm just curious, doctor, as a parent, how do you get your kids not to eat so much candy and chocolate? Because it's so readily available. Everywhere you go, you have access to it. What advice would you give to parents for that?
Sure, and I think this goes back to the whole community effort. You tell your kids, of course you can have a chocolate or you can have a sweet, but you're not going to do it every day. I think it's just teaching them, saying about, okay, let's make good choices and let's make some bad choices. They'll make bad choices and that's okay, but as long as they're making more good choices than bad choices, I think that's the way. I hate to tell people that they can't do something because then you want to do it even more. So I will say, okay, well, let's find a day that we're going to do this. It's like, if we're going to have a dessert on, Sunday and Wednesday? Is it going to be on the weekends? To find something that's realistic that you can do with your kids that'll make it easy. So, Okay,
great. Thank you. Thank you very much. All right, so that brings to a close our educational presentations for today's health fair. We do want to encourage you. We still have a little time remaining for the health fair. It is continuing. It's continuing until 2 o'clock. So please come on down. We still have free testing, site testing, diabetes testing, cholesterol testing. We have diabetes and nutrition consultation going on as well. So you're all welcome to still come down. It's a free event. I want to say a very special thank you to everyone who participated in today's event through their presentations and through their presence as well. I want to say a special thank you to April Cummings and Paul at Cayman Space for helping us out with the streaming and for everything that they've done to make this a success. Have a great afternoon and a wonderful rest of the weekend. And thanks again from the Lions Club. We have coming up next the Bailamos dance group who will be performing some exciting dances for us. So stick around for that as well. Bye.